Every day you read in the paper about the increasing understanding of the role of food and behaviour and exercise in maintaining health. You can also see on every supermarket the increasing engagement of citizens in their healthcare, be that through running clubs, be that through gym membership, through foods that are said to have healthy benefits. And this is causing this huge sort of growth area in a wide range of products and services, all of which are designed to keep people healthy and help them to manage their diseases when they get them, and are paid for by the consumer. And we call this market the consumer health market. As time goes on, more and more and more is understood of the importance of nutrition in treating disease. And those products that are proven to have some kind of a curative impact, but are not medicines, are broadly called nutraceuticals. And there are all sorts of barriers to growth. The first one is just general awareness. So a doctor in most countries in their entire medical training will have less than a day's training on the role of nutrition. So they just don't think about nutrition when they're thinking about how they treat their patients. The second major issue is regulation. You broadly, to try and simplify a complex situation, you broadly got one set of regulation that focuses on pharmaceuticals, which is really designed around patient safety, which is any product has a curative effect. And then you have a whole set of regulation around food. People working in this market need to have quite a range of different capabilities, because these are both effectively a type of medicine and a consumer product. So for an example, if you have a medical food that somebody's going to take every day for the rest of their life, it needs to be available in multiple flavours. It needs to be tasty, it needs to be attractive. People need to want to consume this product. So in that way, you have to understand how to present at a market as a consumer product. On the other hand, you have to have strong evidence. You have to have medical endorsement. It has to be taken seriously, not only by the health system, but also by the patients themselves. And you end up with crossover categories. For instance, you have RX, which we know is traditional pharmaceuticals. At the other hand, you have what we call OTC, over the counter. Many of these foods are what we call OTX, which means they're medically endorsed, but available over the counter. So you have to be able to combine these capabilities of both a consumer product and a pharmaceutical organisation to be able to really manufacture these products, distribute them, engage with both healthcare professionals and consumers to build your business.